Lying right behind there are branches of the middle meningeal artery. And so that fracture of this bone, you get a sharp edge, it cuts that middle meningeal artery there. And blood extends out here laterally, and that's referred to as an epidural hematoma. And that comes basically subdural comes from tearing these little cerebral veins. That comes from tearing bits of the meningeal arteries that are lying on the outside, particularly from below to the side of the head. So here it shows, so you're going to bleed out here. It can be either on the outside of the periosteal dura or between the two layers of dura, where the middle meningeal artery is going. That bleeds into the epidural space out here and compresses, obviously pushes the dura in because there's nowhere for the blood to go to. Whereas the other ones, come, here's some little arachnoid granulations going in there. They don't show a cerebral vein here. Okay. That's essentially all about meninges and things. Obviously you have a neurosciences course sometime later in your curriculum, so we're not going to spend a whole lot of time with the brain, but we're going to talk a little bit about the blood supply to the brain, so you ought to know something about the names of the parts of the brain. And I hope. Okay, so the major lobes of the hemispheres are basically named for their position relative to the overlying cranial bone. Okay, that's pretty straightforward. So the part up front is lying under the frontal bone, or down here over the frontal bone. Within the frontal bone is the frontal lobe. The part under the parietal bone is the parietal lobe. The part that's sort of tucked out here on the side with the temporal bone out here is referred to as the temporal lobe. And then the part in the back is the occipital lobe. You should be able to identify them. But when we get to, we're also going to look at the arteries that supply the brain. And you should be able to know where what parts of the brain individual arteries supply. And down here, that's the cerebellum. Here's another one, not as pretty. But there are there are features that separate on the brain that tell you where the parietal lobe starts and the frontal lobe ends, parietal lobe stops. It's something called the central sulcus, this gap here between the frontal and parietal lobes and the temporal lobe is known as the lateral sulcus. This is the occipital lobe. There's a division back up in there. Down here you've got the cerebellum, this big sort of striped thing is known as the pons, and then the upper part of where the spinal cord runs into the brainstem is called the medulla oblongata. So you should know the gross parts of the brain, because you will look at the main blood supply to the brain. The blood supply to the brain, as you may have figured out from what we've dissected before, comes from two sources. The internal carotid arteries, which you saw dividing from when the common carotid divided into the external and the internal. The external had all these gazillions of branches, which you've memorized and seen. The internal traveled up, went through the carotid canal that we talked about in the skull part, and comes out into the middle cranial fossa and gives rise to a whole bunch of branches, mostly going laterally and anteriorly. The other main blood supply, which you may have seen during your dissection of the neck, were these vertebral arteries, which went up through those transverse foramina in the cervical vertebrae, come up through the vertebrae, loop around the atlas, and go in the foramen magnum to the back of the skull, and they join to form something called the basilar, and then they sort of divide out, and they give rise to all sorts of branches which supply the cerebellum, various bits of the back of the cerebrum. And it turns out, fortunately, that the blood supply from the internal carotid, which is is coming in up here, and the blood supply from the vertebral arteries, which is coming in from the back, are actually connected by these communicating arteries. So that if for some reason, and remarkably frequently, you get a blockage of an internal carotid here, in fact, blood from the vertebrals can go all the way around and fill into this part of the blood supply to the brain. Or if you get a blockage of the vertebral arteries back here, blood from the internal carotids can loop all the way around and come back down here. So there are two main sources of arterial blood to the bottom of the brain, but they're connected, and this connection and the components are referred to as the circle of Willis. Okay. What we want you to do is when you pull out look at the brains today, they should have most of these arteries still attached. You should be able to see them and identify them on the brain. And then we would suggest you do, or at least many of you do, is if you pull out these individual arteries, you don't need to get the little bitty parts, but the rough pattern, we can give you bits of cardboard, and you can take these things, which you get them out, it's just a handful of sort of artery-like stuff, draw the circle of Willis on the piece of cardboard, and pin together the individual branches. There's no better tool for learning how these things go than reproducing it yourself. So if you pull out the brain, pull out the arteries, and then reconstruct them on a piece of pin the bitty parts on the cardboard, you'll have a better idea of how this whole thing works. Obviously, if you pin them and label on cardboard, we're probably not going to use that on the exam. So we'll keep a few brains out, or we'll find some brains somewhere else, so that you should know not only the branching sequence, but you should also be able to identify individual branches should you see them on the brain. Okie dokie, and know where they're going. I mean, know where the middle, roughly what area of the brain the middle cerebral supplies, roughly what area of the brain the anterior cerebral artery supplies, and what part the posterior cerebral. Cerebellar one, pretty straightforward. Okay. The other thing that you will see today, you're responsible to do today, is to identify all these dural sinuses. And also you will see on the inside here the stumps of all those wonderful cranial nerves that you've memorized. And then you should also obviously remind yourself of how each of these cranial nerves gets from the brain inside the cranial cavity to doing its job on the outside. We learned a long time ago, obviously, that the number one, the olfactory nerve, goes out. The olfactory gives rise to you have an olfactory bulb, and then little nerves go through the cribriform plate into the top of the nose, as we talked about. The optic nerve obviously comes out of the brain, crisscrosses here, goes out through the optic canal into the back of the eyeball. And all the other nerves, numbers 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12, identify their stumps on the inside of the cranial cavity and look and see and learn how they get out of the cranial cavity to do the stuff that they do in the outside world. So you should be able to identify the stumps of the cranial nerves within the cranial cavity. Okay, enough of that. But also, you'll have the brain, turn the brain upside down, and identify the individual cranial nerves as they're coming off of the brain stem. Okay, you should be able to see most of these. So there's your olfactory tract and your olfactory bulb. There's your optic nerve and your optic chiasm. Okay, there's number 5, the big old trigeminal with its 3 branches. There's number 6, 7, 8, 9, 10, 11, and 12 going down there. So you should be able to, by the time you leave today, you should be able to identify them within the cranium or on the base of the brain and know how they get out. You can see, you'll see diagrams like this, if not in your dissector, in your atlas. Where am I having this from? I don't have to open this. I don't care. Okay. Yes, yes, yes. Go away. Okay. Okay. Go away. Okay. So those are the things. So just to review, what you have to do today, you have to examine the meningeal layers on the brain and the dura, which may be lying on top of the brain or maybe stuck to the inside of the cranium. Look at the dural sinuses in the cranial cavity. You may want to open them up just to verify that they really are where we said they were. Look at the rough parts of the brain, the lobes of the brain, and the blood supply to the brain, that circle of Willis and the branches related to it. Examine the cranial nerves in the cranial cavity and how they get out of the cranial cavity. Know which all those wonderful foramina, the foramen ovale, hypoglossal foramen, jugular foramen. Identify which ones are associated with which nerves. And then look at the underside of the brain and identify the cranial nerves and where they're coming off. I don't think there may be a picture of that in your dissector. If not, there's pictures of all these, big pictures of these in Grant's atlas. And now, if I can get out of this, I have another charming movie. Okay, so here's today's movie.
Dr. Gold? Well, Dr. Gold, today we're doing all things brain.
This dissection doesn't take very long. That's what Danny did. You saw it. Buzz. They're having more trouble than he did. They seem to be having a lot of trouble today. Yeah. And that's why we asked you to let us do it. Yay. Now they're cutting the bits of the girl away. Okay, let's do this. What's happening here? Now we have science.
And once you have the brain, you can start making. So the first thing we're going to look at is the dura. This part of the dura is called the box cerebrum. It separates the brain and the body from the spirits of the brain. And within this structure, you'll find a couple of sinuses. The sinuses of the dura are actually the venous drainage from the brain. So here you can see the superior sagittal sinus. The inferior sagittal sinus is much smaller and just mirrors it on the inferior border of the box cerebri. Here is the straight sinus. And if we fold the box cerebri down a little bit, we can see the cerebellar tentorium, which is this part of the dura. Within that, we see the transverse sinus running here. And then if you cut the cerebellar tentorium, move that out of the way, you can actually see the sigmoidal sinus just here, where we have the slit. Then you're going to look at major external features of the brain, which we're not going to show you because they're pretty easy to identify. We're just going to move straight to the arteries on the underside of the brain. So here is our brain. And you can already start to see the arteries. So here's the internal carotid artery, cut on both sides. This one is the posterior cerebral artery. Here's the basilar artery, and the two vertebral arteries coming from either side of the spinal column. Next, you're going to look at the cranial nerves on the brain surface. So here's cranial nerve 1, that's the olfactory on both sides. Cranial nerve 2 is the optic nerve. These are the optic tracts and the optic chiasm where they cross over. Cranial nerve 3 is the oculomotor nerve. Cranial nerve 4 is the trochlear, which is just here, this little stub. Can you see that on the video? Yes, good. This little stub here. Directly next to this giant nerve, which is the trigeminal. Cranial nerve 6 is the abducent nerve, it's right here. 7 and 8 are sort of hard to distinguish from each other, but it's the facial and then the vestibulocochlear nerves. 9 and 10 are also hard to distinguish from each other, but they're just here, and that's the glossopharyngeal and the vagus. Let's see if I can get this probe underneath them. Come on, probe. Just there, those fibers. And then 11 and 12 are in our skull, so we're going to show you those once we're in the skull. Once you're done looking at the cranial nerves and the arteries on the underside of your brain, you're going to look at them again on the inside of your skull. So you're also going to identify the 3 cranial foci, starting with the anterior cranial fossa, which is this section. Inside of that runs the olfactory nerve in the pterygiform plate. That's its little stub, just there. Then you look at the middle cranial fossa, which is this one here, and this one here. Within that space, you're going to find your middle meningeal artery. Here's its little stub. It runs within the dura mater, so it's very hard to peel off of the dura. But you can see one of its branches just here. The cavernous sinus is part of the venous drainage of the brain, and it's just in this space. And it runs up to about here on both sides. Running along the cavernous sinus and sometimes within it are 5 nerves. That's the optic nerve, the oculomotor nerve, the trochlear, which is that one, the trigeminal, and the abducent, which is this one. Then you're going to look at your posterior cranial fossa, which is